of Royal Society of Chemistry, United Kingdom. So today, Dr. Vishal Rai will talk about the philosophical connection between the behaviors of human and protein, which inspired him to take this protein engineering of the protein. So Dr. Vishal, up to you.
Thank you very much, Professor Kapoor. Thanks for the nice and elaborate introduction. And at the onset, let me also thank Professor Rajnikant and Professor Kapoor and all my colleagues at University of Jammu for giving me this opportunity for interacting with all of you today. Our group at IISSER Bhopal is developing chemical technologies for precision engineering of proteins. Besides, we are also looking into how it can impact the technological demands of the sectors of biology and medicine. So today, I'll keep some of these methods from our laboratory in the backdrop and tell you a story about the life of Neo. So today's lead character, Neo, is very much like any one of us with a balanced and predictable personality when it's alone. However, things become more interesting when Neo is part of a larger social gathering. For example, if we assume that this lady in the pink top is Neo, you will notice that she is highly likely to coordinate her dance moves with the people in close proximity. And let's just call these people as first circle of the social network. Similarly, there will be second circle, and that is going to be affecting the first one. So the second and the subsequent circles would have indirect impact on Neo's dance moves, whether she realizes it or not. Now, if you compare these modes of communication in a social network with what happens in the cellular communication, there is a very interesting overlap. Also, they are linked as the social network regulates the emotions, which would generate the molecules for the relay of information. And then it regulates the communication and actions of mind and body. For analogy, you can simply consider the generation of neurotransmitters and how they regulate the function of the body on a day-to-day basis. Now, as you can see, that it is a closed loop, and the dimensions of the network can alter, but eventually the social network is bound to have an impact on the actions of Neo. Now, this loop would also give you a glimpse of a very strong philosophical connect between neuroscience in this segment with biology, medicine, physiology, and how it relates to even psychology and anthropology. So I hope you would have realized that all these segments might sound distinct on surface, but they're still part of the nature and they are inherent segments. So they will have a philosophical connect between them, and irrespective of how we study them as humans, that inherent connection between all these segments would stay strong. And if we can understand them better, then the knowledge and philosophies of one segment of this science can definitely benefit the other segments as well. So with that little backdrop, let me bring you back and let's have a look again at how the social network of cellular communication would operate. And then you would realize that the network quite often would regulate the function of a molecule based on where that molecule is localized and who are the neighbors of that molecule. And based on this, the same molecule can have very distinct functions, and that is what we define as promiscuity. Okay, so this connection between social network and how it contributes to localization factor and the interacting partners, defining the outcome of the molecule that can go in very distinct directions is a very, very important thought process that I would request you to hold for a moment. And with that, let's reimagine this new as not a person, but to a much smaller size, and let's assume that it is a functional group, a collection of few atoms, and its characteristic behavior is to donate a pair of electrons, and by that definition we can call mu as nucleophile. So till it is sitting alone in a small molecule, the characteristics of mu are going to be homogeneous and predictable. But once it starts socializing with multiple functional groups around it, the spectrum of behavior is going to broaden up. And that's exactly what happens when this nucleophile becomes a part of a protein. Now, the other levels of the social circle would also start coming into play as this goes to a more complex system such as live cells, tissues, animals, and humans. Okay, so what we are saying is that in general, we have a very good understanding of how a nucleophile can donate a pair of electrons to the electrophile and lead to bond formation. And we also understand that how it can take back its pair of electrons and lead to bond dissociation and break this relationship. Okay, and that leads us to the most prominent question of my talk, that can we take this forward and have a clear understanding of a spectrum of nucleophiles behavior in a far more complex social ecosystem? And once we come up with this knowledge, then can we utilize it for developing chemical technologies for precision engineering of these proteins? Okay, so now, in a nutshell, what we are saying is that there's a huge landscape of nucleophiles behavior that is yet to be explored. But before we can take such a massive exploration, it is essential to understand a few details at the molecular level. So I'll bring this philosophical connection that I have been discussing at the human level and the animal level down to the molecular level, and we can see how that actually helps in coming up with technologies for precision engineering of proteins. So now we have a nucleophile that is sitting in a protein, and then there are several other nucleophiles that are sitting along with it, and they have the same characteristic that they can donate a pair of electrons. So if we are going to add an electrophile to a protein that is sitting in, let's say, aqueous medium, then this electrophile is going to face a very fierce competition from different types of nucleophiles. And let's just assume that this electrophile likes to react with primary amines. So that is what we define as chemoselectivity, that a particular electrophile would have preference towards one type of functional group. But chemoselectivity alone is not good enough for precise single site modification of a protein. And the reason is simple, that primary amine would have multiple copies in the protein. So if you want to target just one of them, the electrophile will also have to figure out how to differentiate the reactivity of that one copy from multiple other copies that are sitting in the protein. And that is what I am going to term as site selectivity. Now, based on the pKa values and the solvent accessibility, there will be a defined reactivity order of all the primary amines that are present. And you might imagine that if we add an electrophile, the most reactive one, and let's say it is this one, might be able to react with it. And let's say that is reactivity hotspot, something that gives highest reactivity and solvent accessibility. But if you want to go beyond reactivity hotspot and let's say modify this primary amine, Is that even possible? So is it possible to go beyond a reactivity order defined by the protein and regulate what site you want to modify? And that is what I'm going to term as modularity in the upcoming slide. So these three terms, chemoselectivity, site selectivity, and modularity, will be often used in the later slides. Okay, so at this point, you can very well ask that this is all good, a complex question, but why do we need to even solve it? Okay, so the basic understanding of reactivity and diverse aspects of selectivity in protein modification allows us to develop tools for biophysical chemistry and biochemistry. And there is a huge demand of precise control in this segment, which is still largely unmet. But what really excites our research group at IISSER Bhopal is the possibility to contribute to directed cancer chemotherapeutics by synthesis of homogeneous antibody drug conjugates. And as the name suggests, this molecule is a combination of a monoclonal antibody which is connected to a drug or toxin molecule through a linker in a covalent fashion. So monoclonal antibody is just a large protein, 150 kilodalton approximately in the size. So the job of this antibody in this conjugate is to go after an antigen that is another protein and is overexpressed in many tumor cells. They serve as biomarkers. And so the whole point is that the normal cells would not have them in sufficient concentration, whereas tumor cells would have them in large concentration. So if you have an antibody that would go specifically bind to it, and then this overall complex eventually would get internalized, and in lysosome there would be a degradation which will release the toxins that can eventually lead to apoptosis or death of the cells. So based on this state-of-the-art platform, around 12 drugs have been approved in last month. And you would notice one commonality between most of the drugs that are out there in market right now, that they are sold as heterogeneous mixture. And what that means is that there would be 0 to n number of toxins attached per molecule of the monoclonal antibody. And this heterogeneity is very well established to be detrimental for pharmacokinetics and batch-to-batch reproducibility. But not much can be done about it simply due to lack of enabling technologies in the field. Now, if you look a little further, the exact same problem has been bugging down the field of conjugate vaccines, where you have a carrier protein connected with an oligosaccharide-based antigen or some other antigenic molecules. And it is also impacting the imaging-guided oncologic surgery or photodynamic therapy, where antibody-based fluoroconjugates and other PET conjugates are utilized. And we have been working in some of the areas related to this with our collaborators. But with that particular background of working in biologics, in the long run, we also want to see if we can go beyond that and come up with the small molecules for precision therapeutics. And the idea here is that if we can target a single nucleophile of a single protein within the human body, then we will have an amazing opportunity to come up with this precision that has so far been possible only with biologics. And that would be amazing, because then we are looking at drugs that are super precise, but then at the same time, they're affordable for most of the people on this planet. And that would require us to come up with solutions to multiple challenges in targeting a particular site in a complex system. So before we can work with systems as complex as humans or tissues or cells, we would first need methods and knowledge that would allow us to do precision engineering of sites in isolated proteins. And once we have those methods, then we can translate them systematically from one level of complexity to the other. So at this point, a very valid question would be that do we not already have drugs that are highly specific in nature? So let me take one example to give you a glimpse of that. Kinases are excellent enzymes for regulating various critical signaling pathways in humans. So it's not really a surprise that a huge segment of pharma sector has been focusing a lot on developing kinase inhibitors in the past few decades. So just last one decade has seen around 38 approved drugs in this segment. And that tells you a lot about how aggressively people have been working in this area. So if you look into some of the most specific drugs from this segment, you would realize that they still go for around 30 to 100 known targets within the kinome, within the pool of kinases, and then there are multiple other unknown targets. So it's not really a surprise that the patients who administer these drugs, they do often face serious side effects. And if we are able to solve the problems in the long run, we would be able to address some of these drastic challenges. So with this little background, we moved on to the first question towards solving these big problems, that let's see if we can develop methods for precise single site modification of unengineered proteins. So we started with a relatively simple question where we said that first let's see that whether chemical methods are even capable of targeting reactivity hotspots, the sites that have more reactivity and solvent accessibility, can they be targeted in a reasonable conversion without touching the second site? However, as an organic chemist, there's one problem that was required to be solved in this case. There's a huge concentration disparity that happens in bioconjugation versus typical organic chemistry reactions. So if you look at any textbook reaction that you would be doing in your laboratory, you would typically be working in the millimolar to molar range. Now to work with proteins, you have to bring down the concentration to low micromolar range. And that practically also means that you will be impacting the kinetics. You will bring down the kinetics considerably. So the bioconjugation that has been practiced more often in the world right now, the bioconjugate chemist would typically take a large excess of electrophile, and that takes care of the kinetics. But then it also comes at the cost of selectivity. So we decided to solve this problem by taking a system where we have two electrophilic centers such that the nucleophilic residue from a protein can attack on the first one, and in this intermolecular reaction, it generates a latent nucleophile that can then give an intramolecular reaction, which is the rate determining step. So the bottom line in simple words is that if we can shift the rate determining step from an intermolecular process to an intramolecular process, then in that case we should be able to decimate the role of concentration. And that's exactly what we found. So with N-hydroxythalamide in this example, just one equivalent was good enough to label the protein, and then this was a single site modification that happened to be at the N-terminus alpha-amine. So with this answer in hand, we moved on to the next question to see that, okay, now can we differentiate a reactivity of a nucleophile from its multiple copies? And for various reasons, we wanted to do this with primary amines coming from lysines. But just now we saw that if we are targeting amines, N-terminus alpha-amine is going to jump in and would serve as reactivity hotspot. So we had to also figure out how to block it, even if transiently. And eventually we found that if we are taking certain types of aldehyde, they react with all the amines reversibly to form imine. The important thing is that the penultimate amide bond near the N-terminus imine can react with it further, and it can give imidazolidiol. And even though it is a reversible transformation, it's good enough to block the reactivity of this N-terminus imine toward the incoming nucleophiles. And that gives the opportunity to see if we can differentiate imine from one lysine with the others. And we found that we can not just do it with copper slides, but we can also do it in a metal-free version using triethyl phosphite in a phosphoharmonic reaction. Now, this approach is not limited only to lysine. We can take it forward, and even with something as simple as cyclohexanone, we were able to demonstrate that histidine residues can be modified with very high specificity in a structurally diverse set of proteins. And in this case, after this Michael addition, we have this carbonyl at our disposal, so we can easily utilize it for installation of various probes that would be needed for various biophysical investigations. But at the same time, we can use this molecule to simply target the his tag in a recombinant protein, and then we can simply utilize this carbonyl for capturing the protein on the resin, and then later, after removing everything else, we can release it through a retro-Michael reaction in presence of imidazole buffer. So it can also serve as a tool for metal-free protein purification. Now, all the examples that I discussed so far were still about targeting reactivity hotspots. So the next question was that how do we go beyond the protein-defined reactivity order? And this is again where the philosophical connect helped us, where we decided that let's figure out how to disintegrate the challenges which primarily involves reactivity, chemoselectivity, and site selectivity, and hopefully more. And then if we can disintegrate the challenges, and we thought that we can do it with multi-step organic transformations, then it is possible to come up with the solutions in a much better way, have much better control on those processes, and then we can combine the solutions together. So let me give you a glimpse of how that works. In the first example where we talked about N-terminus alpha-amine modification, the reaction of electrophile and the nucleophile from protein, that was a one-step process that was regulating both chemoselectivity and the site selectivity. So the first step itself, out of the two steps, that was taking care of both chemoselectivity and site selectivity. But then the second example that we looked upon, we added aldehydes that gave chemoselective reaction with the protein. So the nucleophilic addition to this intermediate only had to worry about the site selectivity. So chemoselectivity and site selectivity are now deconvoluted into two different steps, and you at least have a far better control. Depending on what goes wrong, you know what to control. And at this point, we argued that if we can take this reactive intermediate and create another reactive intermediate from this, the additional step can actually allow us to explore new dimensions of selectivity. And that is exactly what happened. So let me show you one example from this portfolio. One of the simplest amino acid, glycine, if we take this, mix it with this very special aldehyde that has hydrogen bond acceptor in the proximity, it gives a carbon-carbon bond formation between these two, and that's what you see over here. So the way it works is that the amine will react with this aldehyde, form an imine. Now it positions this hydrogen bond acceptor in the proximity, so it's a proximity regulator, which would help in generation of this nucleophilic intermediate, which can then react with another aldehyde, give an amino alcohol, and further hydrolysis at this point would lead to the amino alcohol product that I have shown over here. What is even more exciting is that if this R1 is anything else but hydrogen, then in that case, the conformation required for the activation is not adopted. And that what that means is that this nucleophilic intermediate is not even generated. So the net result is that the reaction is going to work beautifully well with glycine, but no other proteinogenic amino acid, because all of them are substituted amino acids, they would not just result in any irreversible edit. So we took this platform forward and demonstrated that we can target multiple proteins at the N-terminus glycine with very high specificity. We can make recombinant proteins with N-terminus glycine, and then we can target them as well. And taking this forward, we thought that let's see what we can do with this therapeutic insulin. And in this particular example, we have redesigned the glycag reagent a little bit, made a symmetric system, and if we mix it with the native insulin, the amino alcohol formation would happen. We would still have some unreacted insulin. And then we can take this mixture, load it into acyl hydrazide functionalized resin. What it does is that there would be a hydrazone formation that will give me an ordered immobilization of insulin on the surface of resin, and I can recover the unreacted insulin back in very high efficiency, and then I can store this for as long as I want. But if I want to install probe onto this, I'll simply take it out, put it in different tubes, and add hydroxylamine derivatives of the probes that we want to install. So transoximization reaction is going to release the product, and just a centrifugal spin concentration, we get rid of all the small molecules, and then we have analytically pure single site tag proteins, and that's really amazing. This was a new benchmark in the field of bioconjugation of what level of specificity and purity can actually be achieved with the chemical methods. So we took one of these conjugates where we installed fluorophore on insulin, and we demonstrated that you can actually find that they don't really impact the binding with the insulin receptor of this modified insulin, and also the downstream signaling pathway, which we looked into by looking at phosphorylation of AKT, that is also completely uninhibited. But I'll not go deep into this particular segment, and rather talk about what happens when the social ecosystem of this protein is enhanced. So now we have more neighbors sitting in this reaction flask in form of proteins, and we found that the glycag platform still remains highly specific towards the N-terminus glycine containing protein and does not get perturbed by anything else. So we were able to take it forward, demonstrate that we can take an overexpressed protein, and this recombinant protein was expressed in E. coli, and then we were not only able to target this N-glyprotein very specifically, but we were able to do all sort of maneuvering for installation of probes, enriching it, taking it out, and then getting a single site tag protein or native protein in a very good efficiency. Now at this point, we really wanted to see whether we can also somehow figure out how to dissociate this carbon-carbon bond in a chemically orthogonal fashion. So these initial sets of experiment that we performed, where we were adding a variety of base additives, that only just told us that how stable this carbon-carbon bond is. So it was not really straightforward to break it in conducive way under physiological conditions. So after a lot of screening, what we figured out that we can treat it with pyridoxal 5' phosphate, where we have an aldehyde that can react with this amine, form an imine, and then we have an electron withdrawing system on this side. So what it does is, it will start polarizing the electron density towards this, which means that the electron density between this carbon-carbon bond, which was fairly homogeneously distributed between the two carbons. Now, this reagent is telling this carbon that, oh, you deserve to keep more electron density than your partner. And that breaks their relationship, that polarizes the electron density to an extent that you just simply put it under physiological condition and the bond will just break. You have your glycag reagent, and then this can be further hydrolyzed. It's an aqueous medium, and that eventually gives the native insulin along with all the reagent recovery. So now we had bond formation and bond dissociation chemistry that was not just residue specific, worked under physiological conditions, but they were chemically orthogonal in nature. So one can be done without inducing the other. So we took this forward and demonstrated that we can have a metal-free protein purification platform where you can just do that by having one single amino acid as the end terminus of the protein. So we developed the resin functionalized with GlyTag resin, with the GlyTag reagent, and then you can take this recombinant protein that is overexpressed and then just pour it over. And glycan-containing protein would be captured in high efficiency. You can take out the other things, store it for as long as you want. If you want to use it as biomaterial, this is excellent because now you have ordered immobilization. But then if you want to just use it for purification of the native protein, treat it with PLP-based buffer and you have your recombinant protein in analytically pure form. So the GlyTag purification resin now is also accessible to the rest of the scientific community. So with this, we move forward to the final question that I would like to discuss today, where we wanted to really have an understanding of whether it's possible to come up with a modular technology to precisely label a nucleophile in a protein. Okay, so we knew that if we are targeting a particular residue, they might not offer us unique characteristic that can be targeted by a chemical reagent, but coupled with their neighbor, that's a possibility. So the idea was to harness their social ecosystem. In other words, the point that we were looking at is that what if we target a pair of residues where I'm highlighting a lysine and a histidine in this case of a protein fragment. So if we can design a reagent that has two functional groups, FK and FH, says that FK can give me a very rapid reaction with all the lysine residues that are solvent accessible, and then allow me to control the micro concentration of FH near a particular histidine depending on how I design my spacer, then in that case, the site of histidine modification would be based on the design of the spacer and activity order of the protein. Now, the other important point to notice here is that the desired selective pathway is going through an intramolecular process, whereas any background non-specific reaction has to traverse through an intermolecular pathway. So we also have an advantage of 2 to 3 orders in terms of kinetics, and that exactly shows up in this particular example of myoglobin, where simply by repositioning the FK and FH with respect to each other in 3-dimensional space, we were able to target histidine 36 or histidine 81 without touching any other residue. And this is not limited to just one protein. We have worked with a variety of structurally diverse proteins and demonstrated that this is a very general platform where the reagent design can enable precise single-site modification. And then we took it forward, and once the job of linchpin is done, you can simply utilize this aldehyde for installation of a variety of probes, but even better would be that you use it for immobilizing it on the resin, get rid of unreacted myoglobin, and utilize the transoximization reaction to get analytically pure single-site tag proteins. So at this point, we were all set to see how we can translate these methods for synthesis of antibody-drug conjugates. So before I get into that, let me give you a quick recap of the challenges that is posed by this ADCs. So as we discussed in the initial slide, the ADC consists of 3 components. One of them is toxin, which in this example is monomethyl auristatin E. The second component is the antibody, which is this Y-shaped molecule that is coming on your screen. And then the third component is the spacer that connects the toxin with the antibody. And that also leads to the first question, that how do we maintain the homogeneity of this bioconjugation? And once that is figured out and these ADCs are injected into the patient's bloodstream, the next important thing is that the toxin should not be released before reaching the target. So the bond strength that is holding the toxin together with the antibody, that becomes a very, very critical aspect. And if that is not regulated properly, the toxins will be released, leading to off-target effects on the natural cells. All the specificity component that is coming would be gone. So the chemistry that regulates the bond type and bond strength is critical. And then once these things are taken care of, and these ADCs would eventually reach the tumor cells where they have an antigen to bind, you would notice that it is important the conjugation site should not be blocking the antigen binding fragments. And that is critical to ensure that this binding happens efficiently, and then this overall complex gets internalized, and then eventually it is going to reach the lysosome, as you can see right now on your screen, where there will be sufficient number of proteases to chop this off, release the toxin that would lead to apoptosis or cell death. Now, this is just one pathway of how the ADC works, which I have highlighted as receptor-mediated endocytosis. And I will not go into these details, but with the current state of knowledge, we have a much better understanding of what alternative pathways are involved and how some of them can be contributing to the resistance that would come forward through the ADCs. So with that understanding, we really have a very good idea that the ideal platform for ADC preparation should be regulating not just homogeneity and drug to antibody ratio, but it should provide a very good control over the chemistry, the residue of conjugation, the bond strength, the flexibility with linker, and the sites of conjugation. And that is exactly what we are trying to do with the LDM platform. So let me give you one representative example where we selected trastuzumab as a monoclonal antibody. We selected M10C as the toxin, and these selections were made specifically so that we can have head-to-head comparison with Kadcyla, which is one of the approved ADCs from Roche in market. Okay, so the LDM-derived ADC, which is shown by this bar, gave excellent inhibition of antigen-positive cells. It outperformed Kadcyla in every trial we did, but more importantly, it just showed no negative impact on the antigen-negative cells, which is similar to what you would think as normal cells. So that was fine. In this particular case, the toxins were attached to the histidine residue, and the LDM platform offers a lot more flexibility, so we can take it forward for lysine modification, and then we can also engineer ADCs where the toxins are specifically attached at, let's say in this example, K169 and K395. And in this case, the LDM-derived ADC gives a great inhibition of antigen-positive cells, outperforms Kadcyla by even bigger margin, and then just shows no negative impact on the HER2-negative cells. So with this, I hope I was able to convince you that the nucleophile has multiple colors, or nu as a person has multiple colors, and social ecosystem would regulate it, and its operational knowledge would provide us the key to breaking multiple barriers of reactivity and selectivity based technological demands. So we have already taken care of some of these things where we have biotech tools, protein-based therapeutics, and precision therapeutics is what we are looking at. But our group in last 2 years has also been working aggressively to see how we can go for protein specificity, organelle specificity, cell and tissue specificity. And I'll be glad to talk about this at a different forum. But for now, all these technologies I discussed today is accessible to the scientific community through Playable Tech. Besides, we are also thankful to SERB for believing in our team to establish a precision antibody engineering center to meet the technological demands in this field of biologics in India. And just for your knowledge, biologics is the most rapidly growing sector of therapeutics worldwide and promises to maintain the momentum at least for the next few decades. And with that, it's time to thank all my group members who have done the actual work in the laboratory. I would also like to thank all my collaborators who constantly keep contributing with diverse expertise they bring with them, and all the funding agencies for their generous and constant support. And thank you all for your kind patience. I'll be glad to take your questions.
Okay, thank you, Professor Vishal. I think this is the time for all of us to give a big round of applause to Dr. Vishal Rai. So if you have any question, I think maybe so Dr. Rai will be very happy to answer. So, any question from the audience, students? I think maybe you can put the lights on. Yeah. Today, despite being the Sunday, I think the audience is a little bit thin, but your lecture will be available on the YouTube, which I think all the students, they will be able to just watch whenever they feel like. Okay, so thank you very much, Dr. Vishal Rai. So I think so to this audience one more. This is something which I like about him. So he is a unique kind of person because he has contributed at this young age in the establishment of two industries, one in the Canada and one in the India. So I think so this is something which is very, very unique about him. So I think thank you very much, Dr. Vishal Rai. So next lecture, I think we have hello. Okay, so Vishal, so I think next lecture, so we have offline, and the convener of this event, Professor Rajnikant, so he is going to talk to us.
Thank you very much, Professor Kapoor. So I'll disconnect in that case.
Okay, yes, thank you Vishal once again, thank you. Okay, so Professor Rahul Gupta, to please